Good afternoon, everyone. This is Valerie Riddle. I am a 1989 alum of the Morsani College of Medicine, and I am very honored to be here today with Dr. Brian Williams, who is a 2001 alum of the Morsani College of Medicine, and will be receiving this evening the 2017 USF Distinguished Alumnus Award by the Alumni Society. And I would like very much, Dr. Williams, if you could tell us a little bit more about yourself. I think you'll do a much better job of that than I can.
Sure, happy to. Thank you for having me here. I'm very honored. I was a non-traditional medical student. I had a prior career in the Air Force, so I was active duty for 6 years, and I worked as an aeronautical engineer doing flight tests. And during that time, about my 4th year in, I started having this pull towards medicine. I didn't jump right in because I had a good career. I was happy and good trajectory and comfortable. But at some point it became impossible to ignore, and I just went and made the leap. Did some research, talked to some people. I was kind of flying blind. I didn't have the advantage of a pre-medical advisor. But then in the end, when I was deciding where to go, USF, there was really no competition when I came here to USF. I considered going to a HBCU school, other schools that were offering a lot of scholarship money. But in the end, after I did my interview here and met people here in the Student Affairs Office and the students, it was clear to me that the College of Medicine really valued the education, but also cared about the students as people. It was just in the air. You can't fake that. And in the end, that helped me with my decision to come here.
Well, we're certainly glad you did.
Yeah. As am I.
And what is it that you're doing now?
So right now I'm in Dallas, Texas. I ended up becoming a trauma surgeon, and I worked at UT Southwestern Medical Center. So it was involved with teaching residents and students. But currently I'm in transition to a new position, which is soon to be announced.
So we get to have you back
yeah,
when
sure.
you get to announce that.
Happy to come back to Tampa.
That'd
anytime.
Be awesome.
Anytime.
Very good. Well, I understand, and I'm going to ask you about this, and I hope it's not too difficult a topic, but I understand that you had a pretty significant event in your life and career in the last year, and I wondered if you could share a little bit about that with us.
Sure. So I said I worked as a trauma surgeon. I worked at Parkland Hospital in Dallas, which is one of the iconic trauma centers in the country. And July 7th of last year, that was the Dallas police shootings. So there was a peaceful rally downtown Dallas protesting police brutality against black men. And there was a African-American shooter that was targeting white police officers protecting the event. They had 12 officers shot, 7 were brought to our hospital, and that was the night that I was working that night. So, we have a team of, big trauma team, but I was a surgeon here that night. So 7 came to us and 3 were wounded fatally. And it was one of those, watershed moments in my career, but also my life. It was very impactful for me emotionally, and just really just transformed me after the event. For me, I was at a point in my life where I was really considering my role in society as a black man, but also as a trauma surgeon who sees a lot of gun violence. And this whole event had a lot of elements that were very divisive involved with it. And then you have me in the mix as the only black surgeon in that group. And I happened to be working that night. And this just all came together, and I just could not ignore anymore that I needed to do something differently going forward.
Yeah, I can't imagine what that must have been like.
Yeah. It's been a challenge, and it's been a journey this year, and I've resisted a lot. I was kind of thrust into the national spotlight. I'm a very private person, so that was uncomfortable for me. I've learned to, embrace that discomfort, because for me it's very important that I'm able to wring some good out of this tragedy. It's just senseless and what happened. You have a lot of families that were upended by this, and I don't want to just wallow in the tragedy. I want to take this and turn it into something good somehow. And that's the journey I'm on now. This award is, one of the shining spots of this entire year. Really encapsulates a lot about what's happened as far as being completely surprised by how people reacted to what I've done.
Yeah, it's amazing. I think we face challenges in our lives all the time, and to me, it's not always how you deal with that challenge in that moment,
Right.
but what you take from it and what you do with it. And you've obviously taken that moment and really let it transform you, which is wonderful.
Right.
Yeah.
And not an easy
Not
journey.
easy at all. At
first, I was just along for the ride. Okay.
Yeah,
It
like
took many months
one
before I
foot-
became an active
Absolutely.
participant and really directing how I wanted it to go. And,
Yeah.
hence the transition right now in my career.
Wonderful. Wonderful. It's really, I'm honored and proud to be sitting with you
Oh, thanks.
here today. What do you do to recharge your batteries after something either like that or any day in your life, which I'm sure as a trauma surgeon has plenty of them?
Right.
So anything you do for fun or?
Yeah, for fun, my daughter is a constant source of entertainment for me.
And she's how old?
She's 6 years old.
Oh.
Every day it's something new. She goes from, infuriating to adorable in about 3 seconds flat. I read, or work out, do things with the family.
Yep.
We try to do, regular things once a week where we all go out and do something together. I'm really into music. I play drums. I need to get a new drum set now, so I can get back into that. And try to spend quality time with people in my life.
Yeah.
Something I did a poor job of. Once I had medical school, I just kind of forgot all these people.
Yeah.
And I realized that a lot of time was lost by
Yeah.
doing that. So I'm
Yeah.
trying to recapture that now.
That's great. That's wonderful. Can you describe, I know you talked a little bit about what brought you to USF
Right.
and why you chose that over the other choices you had. Can you reflect back now on anything in particular that did you get what you thought you would get from USF, or did you get something that surprised you?
USF was a bargain. I got a lot more than I anticipated from my experience here. Beyond just having lifelong friends and mentors to emulate, when I left the university to go to my residency, I had this ethos about how I wanted to be as a doctor, not just from being just a doctoring part, but just how I wanted to be as an educator with students and trainees, how to be a mentor and a sponsor. All those things they don't really teach you in class, but you learn from your environment. That I took with me, and I didn't anticipate how important that would be for me in my career.
Yeah. Anything else that I haven't asked you about that you think is important to share for our alum who will be hopefully viewing this video and interview, and any words of wisdom for us?
One thing I learned from my time at USF was that you never can underestimate the power of a single interaction with someone. I can think about many times through my time here that one interaction with individuals I still remember now 20 years later, and it was some things I want to emulate myself as a physician. So the students are always watching you.
Yes.
Your residents are always watching you, and your patients are always watching you, and I really take that to heart when I go out and do my job, recognizing that I can have the impact on someone and not even know it.
Yeah. Well, thank you. Thank you very much for your service in the military.
Thank you.
And for your service to those police officers in a time that I'm sure was very difficult. And thank you for being here today and being such a pleasant individual to interview.
No, thank you for having me. I appreciate it.
And thank you all for watching.